Hello, my name's Ed and I'm one of the counsellors with Devon Mind. Welcome to our webinar series, With You in Mind. Today we are going to be looking at emotional regulation. We will begin by defining what it means to be emotionally dysregulated. What happens to us on such occasions, and what are the possible causes that lie behind these states? Once we have an understanding of emotional dysregulation, we will move on to explore what it means to be emotionally regulated. As well as identifying the core components of emotional regulation, we will also discuss possible strategies and techniques that we can utilize to more reliably regulate our emotions. As we approach the end of our time with one another, I will share two alternative metaphors that we can draw from to better understand emotional regulation and its significance in terms of our well-being. Finally, Devon Mind's clinical psychologist Cheryl will provide answers to some frequently asked questions regarding emotional regulation. Please also keep in mind the further resources section should you wish to do any of your own research. So, what is emotional dysregulation? Emotional dysregulation refers to a condition or state in which an individual has difficulty in effectively managing or controlling their emotions. It involves a lack of adaptive and appropriate emotional responses to various situations. People who experience emotional dysregulation may have intense emotional reactions that are disproportionate to the situation, and they may struggle to modulate or regulate their emotions in a way that is socially acceptable or conducive to their well-being. There are several psychological, emotional, behavioural, and relational markers that together characterise emotional dysregulation. These include emotional intensity. Individuals may experience emotions with heightened intensity, such as extreme anger, sadness, or anxiety, even in response to relatively minor stressors. Emotional lability. Emotional states may fluctuate rapidly, and individuals may have difficulty stabilizing their emotions over time. Difficulty in self-soothing. People with emotional dysregulation may have trouble calming themselves down when they become upset or agitated. Impulsivity. Emotional dysregulation can lead to impulsive behaviors, such as self-harm, substance abuse, or reckless actions, as individuals may act on intense emotions without considering the consequences. And finally, interpersonal problems. Emotional dysregulation can strain relationships, as others may find it challenging to interact with someone who has difficulty managing their emotions. What are some of the possible causes that may lead to an individual having difficulty in regulating their emotions? Emotional dysregulation can have various underlying causes and often results from a complex interplay of genetic, environmental, and psychological factors. Some of the suspected causes and contributing factors include environmental conditions. A challenging or unstable environment during childhood, including inconsistent caregiving or a lack of emotional support, can contribute to emotional dysregulation. Growing up in a household with unpredictable or chaotic dynamics may increase the risk. Trauma and stress. Exposure to traumatic events or other significant life stressors can disrupt a person's ability to emotionally regulate. Substance abuse. Substance abuse, including alcohol and drug use, can impair the brain's ability to regulate emotions, leading to emotional dysregulation. Neurological conditions. Certain neurological conditions, such as epilepsy or traumatic brain injury, can affect brain functioning and emotional regulation. And finally, biological factors. Hormonal changes, such as those associated with puberty, menopause, or certain medical conditions, can influence emotional regulation. Now that we have defined emotional dysregulation and have identified some of its possible causes, let's turn our attention to emotional regulation. Emotional regulation, also referred to as emotion regulation, is the process by which individuals manage, control, or modulate their emotions. It involves a range of strategies and techniques that people use to understand, cope with, and adjust their emotional responses to various situations. These strategies can include mindfulness, deep breathing, cognitive reappraisal, and seeking social support to either enhance or diminish the intensity and duration of specific emotions. Effective emotional regulation is essential for maintaining psychological well-being and healthy interpersonal relationships. As a brief example of emotional regulation in action, imagine a person who is prone to feel anger and frustration when dealing with work-related stresses. The person recognizes, however, that these emotions can sometimes lead to unproductive conflicts with colleagues and negatively impact their overall well-being. To practice emotional regulation, they may opt to draw from several strategies and techniques. One such strategy may be cognitive reappraisal, in which the person reframes the situation by examining their thoughts and beliefs about the stressor. They try to identify any distortions to their thinking, for example, catastrophizing, and replace them with more realistic and balanced thoughts. This can help reduce the emotional intensity associated with the situation. There are several components to emotional regulation, and whilst the importance of specific components can vary depending on individual circumstances and the context in which emotions need to be regulated, there are some that are generally considered to be key for effective emotional regulation. For our purposes today, I will outline 4 of these components. 1. Emotion awareness. Being aware of your emotions is a fundamental aspect of emotional regulation. Without awareness, it's challenging to identify and address the emotions that may be causing distress or influencing your behavior. Recognizing what you're feeling is the first step in managing emotions effectively. 2. Emotion acceptance. Accepting your emotions, whether positive or negative, without judgment, is crucial. Emotions are a natural part of being human, and suppressing or denying them can lead to emotional difficulties. Acceptance allows you to acknowledge your feelings and work with them constructively. 3. Cognitive reappraisal. Cognitive reappraisal is a valuable skill for changing the way you perceive and respond to situations that give rise to strong emotions. It involves reframing or reinterpreting events to reduce emotional intensity. This component helps you to exert control over your emotional responses by changing your perspective on the situation. 4. Response modulation. The ability to modulate physiological and behavioral responses associated with emotions is essential. This can include managing physical arousal, for example, using relaxation techniques to reduce stress, and behavioral responses, for example, choosing constructive actions when experiencing anger. Emotional regulation, as I hope I am making clear, constitutes an invaluable life skill that can both enhance our well-being and improve our relationships. The following are some of the most important strategies and techniques that individuals can use to keep themselves emotionally regulated. Mindfulness and meditation. Mindfulness involves being fully present in the moment and observing your thoughts and emotions, crucially without judgment. Regular mindfulness meditation practices can help you become more aware of your emotions and better regulate them. Deep breathing and relaxation. Deep breathing exercises, such as diaphragmatic breathing or the 4-7-8 technique, can help reduce physiological arousal associated with stress and strong emotions. Learning relaxation techniques like progressive muscle relaxation can also be beneficial. Cognitive reappraisal. Challenge and reframe negative or irrational thoughts that contribute to intense emotions. By changing your thought patterns, you can change your emotional responses. Cognitive behavioral therapy, CBT, is a well-known approach that teaches these skills. Physical activity. Regular exercise releases endorphins, which are natural mood lifters. Engaging in physical activity can help reduce stress and promote emotional well-being. Healthy lifestyle choices. Prioritize sleep, maintain a balanced diet, and avoid excessive caffeine, alcohol, and substance use. A healthy lifestyle supports emotional stability. Journaling and self-reflection. Keeping a journal allows you to explore and understand your emotions better. Write down your thoughts and feelings to gain insights into your emotional life. Social support. Talk to friends, family members, or a therapist about your emotions. Sharing your feelings with a supportive person can provide both comfort and perspective. Limiting exposure to stresses. Identify and reduce exposure to situations or people that consistently engender negative emotions. Sometimes avoidance can be a helpful short-term strategy while you work on more long-term solutions. Finally, seeking professional help. If you find that difficulties with emotional regulation significantly impact your life or relationships, consider seeking help from a therapist or counsellor. They can provide guidance and techniques tailored to your specific needs. Remember that emotional regulation is an ongoing process, and it's okay to seek support and practice these strategies regularly. What works best for you may vary, so it's important to experiment with different techniques to find what helps you manage your emotions effectively. We have already mentioned that the first step in approaching emotional regulation is emotion awareness. Since mindfulness practices come into their own in terms of both generating and sustaining awareness, let's take a closer look at some possible mindfulness practices you may wish to work with. Please keep in mind that each of these practices can be done more or less formally and, owing to their simplicity, can be adapted to fit a wide range of circumstances. Mindful breathing. Find a quiet place to sit or lie down. Close your eyes and take deep, slow breaths. Focus your attention on the sensation of your breath entering and leaving your nostrils, or the rise and fall of your chest or abdomen. Whenever your mind starts to wander, gently bring your focus back to your breath without judgment. Breath counting. Sit or lie down in a comfortable position. Inhale deeply and, as you exhale, silently count 1 with the voice of the mind. Inhale again, and as you exhale, count 2. Continue counting each exhalation until you reach 10. Then start again from 1. If your mind wanders, gently bring it back to the count without judgment. 5 senses exercise. Sit quietly and take a few deep breaths to center yourself. Then, one by one, focus on each of your 5 senses. Notice 5 things you can see, 4 things you can touch, 3 things you can hear, 2 things you can smell, and 1 thing you can taste. This exercise helps ground you in the present moment. Mindful eating. Choose a small piece of food, like a raisin or a slice of fruit. Examine it closely, noticing its texture, colour, and shape. Slowly bring it to your mouth, taking note of any smells. Chew slowly and savour the taste, paying attention to the texture and flavours as you eat. Body scan. Lie down comfortably with your eyes closed. Start at your toes and slowly move your attention up through your body, paying close attention to any sensations or tension you feel in each area. Relax and release any tension you notice. Walking meditation. Take a slow, mindful walk. Pay attention to each step you take. Feel the sensation of your foot lifting off the ground, moving through the air and making contact with the earth. Notice the feeling of your body in motion. Mindful observation. Choose an object in your environment, like a flower, a tree, or a piece of art. Spend a few minutes simply observing it without judgment. Pay attention to its details, colours, and shapes. And my personal favourite, daily routine mindfulness. Incorporate mindfulness into your daily routine by paying full attention to everyday activities, such as brushing your teeth, washing the dishes, or taking a shower. Engage in these activities with your full awareness. Remember that mindfulness is a skill that takes practice. If any of these approaches appeal to you, start with short sessions and gradually increase the duration as you become more comfortable with whatever it is you have chosen to work with. The key is to be patient with yourself and cultivate a non-judgmental awareness of your thoughts and sensations in the present moment. Another powerful technique for regulating our emotions that we have already mentioned is cognitive reappraisal. Given its efficacy in helping us to modulate our responses to situations, it will be worth our while to spend a little longer describing cognitive reappraisal in more detail. Cognitive reappraisal is a psychological concept and a key component of emotion regulation. It refers to the process of reframing or reinterpreting the meaning of a situation or event in a way that alters its emotional impact. In other words, cognitive reappraisal involves changing the way you think about a situation to change how you feel about it. Cognitive reappraisal can be broken down into 3 steps. 1. Initial emotional response. When we encounter a situation or event, our minds automatically generate emotions based on our perceptions and interpretations of that situation. 2. Cognitive re-evaluation. With cognitive reappraisal, we consciously and deliberately re-evaluate the situation by considering it from different perspectives. We may ask ourselves questions like, is this situation as bad as it seems? What are the potential positive aspects of this situation? Or how might someone else view this situation? By asking these kinds of questions and challenging our initial emotional response, we can begin to change our perspective on a situation. 3. Emotional reappraisal. As we reinterpret the situation and see it in a different light, our emotional response can change. What was initially a negative or distressing emotion can become less intense or even shift to a more positive or manageable emotion. As we can see, cognitive reappraisal is a valuable emotion regulation strategy that can help us to manage our emotions in various situations. It is often used in CBT and other therapeutic approaches to help individuals cope with stress, anxiety, and negative emotions. By learning to reframe our thoughts and perceptions, we can reduce the impact of challenging situations and improve our overall emotional well-being. Before we bring matters to a close for today, let's touch on 2 alternative metaphors which provide us with different perspectives on, and therefore a more complete understanding of, emotional regulation. The first of these metaphors involves a consideration of 3 possible states of mind. These are emotional mind, rational mind, and wise mind. These conceptualizations are often associated with dialectical behavior therapy, DBT. Let's have a look at each of these mind states together and explore how they might relate to emotional regulation and our overall well-being. Emotional mind. Emotional mind is characterized by intense emotions and feelings. When you are in an emotional mind state, your thoughts, decisions, and actions are primarily driven by your current emotions. This state can be overwhelming, impulsive, and reactive. In terms of emotional regulation, recognizing when you are in an emotional mind state is the first step. Once aware, you can then use strategies to calm intense emotions and prevent impulsive or unhealthy behaviors. Techniques like deep breathing, relaxation exercises, and even distraction can help you move out of emotional mind and into a more balanced state. Rational mind. Rational mind is the opposite of emotional mind. In this state, you are primarily driven by logic and reason. Your decisions are based on facts, evidence, and detached analysis, often without much consideration of emotions. While rational thinking is valuable in many situations, relying solely on rational mind can lead to emotional suppression or even detachment. Emotional regulation involves recognizing when emotions are valid and important and integrating them with rational thinking. This can involve acknowledging emotions without letting them override logical decision making. Wise mind. Wise mind is a balanced state that combines both emotional and rational aspects. It represents a state of mindfulness and balanced decision making. When in wise mind, you are in touch with your emotions and can use them as valuable information without being controlled by them. You make decisions that align with your values and aspirations. Emotional regulation often seeks to guide individuals toward wise mind. Techniques and skills for achieving wise mind include mindfulness practices, emotional awareness, and learning to consider both emotions and rational thoughts when making choices. The goal of emotion regulation in the context of these three states of mind is to move from emotional mind, when emotions are overwhelming, or rational mind, when emotions are disregarded, into wise mind. Wise mind allows for more adaptive and effective emotional regulation because it integrates both emotional and rational aspects of thinking and decision making. The second metaphor that we are going to talk about today rests on what is referred to as the window of tolerance. The window of tolerance is a psychological framework that helps us understand and manage our emotional and physiological responses to stress and arousal. It was developed within the field of trauma and stress psychology, and it is often used in the context of trauma therapy and emotional regulation. There are several key components relevant to the window of tolerance. Arousal levels. The window of tolerance refers to a range of emotional and physiological arousal levels within which an individual can effectively cope with and respond to stresses. These arousal levels encompass a broad spectrum, ranging from low arousal, for example, feeling calm and relaxed, to high arousal, for example, feeling extremely anxious or agitated. Optimal functioning. When a person is within their window of tolerance, they are in a state of optimal functioning. They can think clearly, make rational decisions, regulate their emotions, and effectively engage with the demands of their environment. Outside of the window of tolerance, there are two main zones: hyperarousal and hypoarousal. Hyperarousal occurs when a person's arousal levels become too high. They may experience intense emotions such as panic, anger, or anxiety. In this state, it becomes challenging to think clearly or make rational decisions. Physiological symptoms like increased heart rate and shallow breathing are also common. Hypoarousal falls on the other end of the spectrum and occurs when a person's arousal levels become too low. This state is often associated with feelings of numbness, dissociation, or shutdown. In hypoarousal, individuals may struggle to engage with their surroundings or their emotions, and they may appear disconnected from their experiences. Understanding the window of tolerance can be beneficial for anyone seeking to improve their emotional regulation skills. As we have already alluded to, emotional regulation is rooted in self-awareness. Understanding where we fall within our window of tolerance is a central aspect of emotional awareness. When we are within our window of tolerance, we are better equipped to identify our emotional state accurately. For example, we can recognize when we are starting to feel slightly anxious or mildly irritated. By extension, the window of tolerance helps us recognize when we are moving outside of our optimal functioning range. For instance, if we start to experience heightened emotions like anger or anxiety, indicative of moving into hyperarousal, or feelings of numbness and detachment, indicative of moving into hypoarousal, we are becoming dysregulated. It is here that emotional regulation strategies come into play, when we recognize that we are moving out of our window of tolerance. These strategies can include grounding techniques. When someone is in a state of hyperarousal, grounding techniques like deep breathing, progressive muscle relaxation, or mindfulness practices can help calm their nervous system and bring them back into their window of tolerance. Self-soothing. Self-soothing techniques, such as engaging in comforting activities or talking to a supportive friend, can be useful when someone is experiencing emotional distress. Emotion expression. Expressing emotions in a healthy and constructive way is another aspect of emotional regulation. When someone is within their window of tolerance, they can express their feelings assertively and communicate their needs effectively. Expanding the window. Through therapy and practice, individuals can work on expanding their window of tolerance. This means increasing their capacity to handle a broader range of emotional experiences without becoming overwhelmed or emotionally shut down. And finally, preventative measures. Emotional regulation is not only about managing emotions when they become overwhelming, but also about implementing preventative measures to stay within one's window of tolerance. This includes self-care practices, stress management, and lifestyle choices that promote emotional well-being. To summarize, the window of tolerance is a helpful framework for understanding how emotional regulation works. It provides a visual representation of the optimal range within which emotions can be effectively managed. Emotional regulation involves recognizing when one is moving out of this window and using appropriate strategies to return to a state of balance and well-being. Before saying goodbye and leaving you with Cheryl, I would like to thank you for your time and express my hope that today's webinar has been useful to you, both in terms of describing emotional regulation, as well as introducing some practical strategies and techniques whereby our emotions can be more reliably regulated.
Hello, my name is Cheryl and I'm a clinical psychologist who is working for the Devon Mental Health Alliance. And today I'm going to be answering some common questions that people have about regulating our emotions. It's important to say that all of us are trying to regulate our feelings and emotions on a daily basis. And when things happen to us that hurt us or cause us some difficulty, that we can all at times struggle to manage our emotions and feel overwhelmed, even when we try not to. It's also important to remember that for some of us, depending on our experiences of being in the world, especially as children, we may be far more likely and understandably struggle to tolerate and manage more difficult emotions. So please show yourself and your emotions compassion. Question 1. If we've always struggled to manage our emotions, it can feel impossible to know how to respond differently, especially as we don't get born knowing how to do it. However, it is possible to learn different and more helpful ways of managing difficult feelings and emotions. There are many ways in which you can do this, such as groups run by the Devon Mind, There are some online resources at getselfhelp.com, and also talking therapy can help. The trick is finding what fits and works for you, as we are all different, and like with most things, we cannot take a one-size-fits-all approach. So it's helpful to explore and try a variety of different approaches to regulating our emotions. When we try something new, it makes us feel vulnerable. And as humans, feeling vulnerable makes us feel uncomfortable. And we want to avoid feeling like that. So try not to give up on your first try. We have to practice, as it takes time and a willingness to give it a go. But you will notice the more you do it, and over time, you will find it gets easier, and you will start to feel less out of control or overwhelmed by your emotions. Question 2. Yes, how our parents managed emotions can influence how we then manage our own emotions. It's important to say that this isn't about blaming parents, as it's really difficult to know what to do and how to respond to our emotions if we haven't been shown. Much the same, if our parents weren't shown how to cook, read, swim, ride a bike, then how would they know how to teach us? It's just the same with understanding and regulating our emotions. It's not unusual to look back over many generations and see that over many years, the family members have struggled with emotions and tried to manage in the best way they can. It would be much easier if there was a guide for parents to know what to do and when, but it's complicated being human, as we are generally not straightforward. If our parents were never shown how to manage emotions in a helpful way, then it's near impossible then for our parents to show up. Therefore, if we've grown up around caregivers that don't show emotion or help us to understand our emotions, how to respond to them as children, we would not have learned the helpful ways of managing and tolerating emotions being around. We look to our parents and caregivers to understand how we should be in the world. If emotions were not tolerated or talked about or understandings given to them, then how do we know how to figure them out and manage them? And that's why it's important that we try and find more helpful ways as adults to look at how we regulate them. Question 3. Yes, if we were told off as children for expressing emotions when upset or angry, then we learn to push those feelings and emotions away. And this is something that we will then continue to do throughout our lives until we're shown another way. We may notice that we feel ashamed or guilty if we do express emotions, and we may also struggle to know how to respond to others when they show emotion. Our experiences with our parents or main caregivers gives us information of how to be in the world, and our brains will then generalise this. For example, if we're told off for getting angry and upset as children, get a message that all people will be the same, and we will learn to hide these emotions and feel shame for having them, both as children and as adults. As I mentioned in question 2, this isn't me blaming parents. Often it's because parents who tell off their children when they're upset or angry don't know how to respond in a more helpful way. And it's more likely that they also had the same experience of being told off themselves. We as humans are emotional beings, and it's expected and okay to have emotions, but they can often feel scary and overwhelming if we're not used to expressing them. We also know that if we don't express them and continue to push them away, then emotions will often find a way of showing themselves in other ways, for example, becoming physically unwell. So it's really important to try and find ways of being able to express our emotions in healthy ways. Question 4. We can understandably feel like there is something wrong with us when we feel so overwhelmed by our emotions and at a loss of how to control them. But this doesn't mean that there's something wrong with you. Some people in the past that I've worked with have said to me that they felt like they were broken. And I promise you that you're not broken and there's not something wrong with you. It's more likely that you haven't been shown how to manage your emotions, or that you've had some really difficult experiences leading you to feel this way. Some medications might be helpful in the short term. However, medication will not be able to make them go away completely. What we need to do is to be able to learn how to listen and respond to our emotions in a different way. And this is something that medication, unfortunately, cannot do. It might help to reduce the intensity of the emotional feelings, and this is normally due to a sedative effect. It can sometimes make us feel numb, so we don't have any feelings or emotions at all, which might be helpful in the short term. But in the long term, it might lead us to struggle, as we also don't experience any of the nice emotions, which are the things that enable us to get out of bed in the morning and engage with the world and experience nice feelings, which is important feedback from our efforts and interactions that we all need. So medication in the short term might be helpful in supporting you while you're looking at how to manage your emotions and respond to them in a different way, but it won't completely solve the difficulties that you have.